couple of years, the Reduction Act made several changes to the prescription drug plan. So what's happening is, first of all, you're supposed to get an annual notice of change. And if you haven't gotten it by, say, October 3rd, you need to call your insurance agent, say, I need to have that given to me soon, because I want to understand what's happening. So the changes that are happening are that in 2024, you would have a maximum out of pocket of about $8,300 once you got into the catastrophic area. But in 2025, there's no longer going to be a catastrophic area, and there's no coverage cap at all. So the plans, there's a number of plans that are not going to be available. They're gonna leave a marketplace because they made mistakes and they can't afford to be selling them. But the plans that are going to be remaining, what you're going to see is you're going to see an increase in your premium. You're going to see perhaps a change in the level of tiers for your medication. And you're going to see a lower deductible. So the maximum out of pocket in 2025 will be $2,000. Did you get that?
I caught that.
Okay. All right. And so the way that happens is you have a deductible on tiers 3, 4, and 5 medications.
Perfect.
Right? So.
Not on 1 and 2, just on 3, 4, and 5.
Not on 1 and 2, just on 3, 4, and 5. And that goes towards your deductible. So if you're on really a lot of medication and expensive medication, 2025 is really going to be very helpful to your pocketbook. Because the most you're going to spend is your $2,000 plus your premium. The premiums are going to be going up. There's no question about that. There are some plans that are still going to be lower premium, and they're basically going to offer you only generic medications, which is okay if you take generic medications.
Sorry, you're talking about advantage plans or supplements?
Talking about both plans, right? Now, the thing that actually scares me the most is there's a company that has chosen to remove all their insurance agents, which is okay. That means people can go direct, and that's fine. But why it scares me to death is, have any of you ever called your prescription drug plan phone number, the customer service?
Yes.
Yeah.
And for the most part, were they American speaking or,
No.
but were they foreign?
No, it's American.
Okay, that's good. I like that. A lot of the plans have gone to folks in other countries. And basically what they do is they sit at a computer and they go through a list of questions. And if your question doesn't meet that, they're not able to help answer your questions. So you're stuck. And I'm afraid that with this one company, people are not going to be able to get the answers that they're really entitled to.
What company is it?
Okay,
Come on.
so I'm talking to you today as Gary Gerstenhaber, not as an insurance agent.
Right.
All right, it's WellCare. WellCare is no longer paying commissions for their drug plans, which is, you know, I can understand it. Last year, they had a plan that they sold for 50 cents per month. They lost their shirt. I mean, how sensible is that? And I happen to have a lot of clients in that plan, and I feel badly for them. But they don't have to stay, you know, it's annual enrollment. So you need to get a hold of your agents. And you need to make sure that they are going to go down the list with you about what the plans are, or how the plans are changing and what they're doing to the medication tier level. So that you won't be caught short. I mean, you'll still probably spend $2,000, but you might be able to save some money with the right plan. And I know the rest of y'all have been in Medicare for quite some time. Are you ready?
Not quite.
Okay, well, good. As long as she's not ready,
Oh, to present or for Medicare?
No.
I thought you were making a joke. I'm ready to present.
So. That really was fun. So, but I'm happy to stick around afterward if you have any questions about Medicare, but I really think what Melissa is presenting to you is a tremendous value. And she has a much better presentation than what I just gave you.
Can I ask one more question before you give up the floor?
Yes, ma'am.
So each of us takes probably different medications. Can we take our personal medications and ask somewhere, which tier am I on? What, are you gonna cover this or not?
Well,
Very specific.
if you have an agent, you need to send him your list of medications and have him send you exactly that.
I'm with ERS.
Oh. Well, then I guess you're gonna have to call it ERS.
Okay,
I mean, I don't.
Like on Humana, they have a website, you just put in the meds.
yeah, they may have it.
A
They have
tier,
the
yeah.
website.
Okay, that was one of the
Here is-
questions I had.
well,
We treat ERS as other people would treat an agent. Right?
Question.
So a tier qualifies for where the drug is gonna rest. So a tier one drug will be a generic drug. There's a whole list of them. And then tier two drug will be a little bit more of a brand name generic drug. And then tiers 3, 4, and 5 are basically brand name medications. And depending upon how long they've been out, then, they'll have a certain, different cost involved.
Does it make any difference if your doctor prescribes that particular medicine?
No. Whatever the medication is, the formulary, I mean, all the insurance companies have different formularies. So they're gonna put a tier, they're gonna qualify your drug in whatever tier they're comfortable with.
There.
Right.
So the tiers are different for different companies.
No, all there's the tiers, 1 through 5, but the medications that go into them based upon whatever the formulary is for that drug plan.
So it could,
Say Randall's Pharmacy, where they tell you what tier that medicine's in.
They should be able to.
That's easier. Good idea.
And Medicare.gov has a website that you can go to, and you can see, once you get the evaluation, you'll recognize that it's in a higher tier because of the cost, which is gonna be attached to it.
Is it the chemical name? In the tier?
No,
No.
the brand name.
It's a brand.
Generic.
Brand.
Chemical.
Right.
I was remembering last year about this time, going online to a website, like Medicare.gov or something, putting in all my medications, and it would spit out the best plan. And I changed plans as a result of
Sure.
last year. Is that not available anymore?
Yeah, it is.
Okay,
Yeah, Medicare.gov has that.
okay.
Oh, okay.
But you gotta really, you gotta study it. I mean, you can't just, because some plan that might cost more money
Mhm.
in the long term might be a better plan for you.
Right.
Depending on the medications. Okay, so I've known this young lady since she was 6 or 7. She was a rascal. And now I can tell you, she's no longer a rascal.
Thank you.
She's a qualified insurance agent who understands her business. And I'm gonna ask her to share with you the presentation on long-term health care.
Oh, yeah.
Hi, everybody. My name is Melissa Roth.
Sorry, Melissa Ross.
Good to meet you. Thanks for the intro, Gary. I'm actually here with one of the partners from our New York Life office, Sarah Silvernail, who is much more of a wealth of knowledge than me when it comes to long-term care. She's from Washington, and when they had law changes and required long-term care plans there, she was a part of all that hustle and bustle. And so she's very well versed. So I just brought her in case there's any more in-depth questions y'all might have. I'm fairly young, about 1.5 years into the industry. So she's been a great resource for me, and hopefully that'll translate with what I share with you. But
Being very modest, she was like your executive council agent last year.
Yes, Mark.
You're related to Clark Ross, who is one of our board members.
Yes, my dad Clark,
Right.
Clark is actually on your board as
Instant
well.
credibility, and don't listen to Dr. McCourse because he always tells people to talk too fast.
Okay. I'll slow it down, but yes, my dad will be at the golf tournament tomorrow, so if any of y'all will be there.
Yeah, a few.
Oh, awesome.
Okay.
A lot of it.
So here's just my name and information. I also have the business cards I can pass out to you guys, but for those of you on Zoom, hello as well. And you can go ahead and write that down if you
How many
need.
do we have on
So just gonna really go over high-level overview of long-term care. I'm sure some of you are familiar with it already, but really just how you can protect yourself for a long-term care event, how when you get into one, you know, what's the plan for you and your family and your loved ones? Has it been spoken about? I know it's not something that people really want to talk about, but when you have a plan written down and discussed with your family and loved ones, it'll make the event be a lot easier on not only you, but the people that you love and care about. So a little bit about our kind of idea behind long-term care planning. You want to make sure you have choice options and are in control of when that event happens, how you're going to be cared for. And then we also like to talk about the 5 pillars of joyful aging, which, you know, it's about your health, your family, your social relationships, which is why Capital City Village is so amazing, financial security, and then your peace of mind. So really just having a plan written down and talk about. And if anybody has questions when I'm going through, I want to make this interactive. So if you guys want to chime in at any point, feel free. And then more just reiteration of what I'm saying, take control over your care, location provider. That's something that you want to make sure you talk about, and the plan that you have, whether it be paying for your care out of pocket, paying for it from qualified funds, or a combination of long-term care insurance plans, which we offer, and out of pocket, that you make sure you know where that care could happen. And then just protecting your retirement, family, again. So what really is a long-term care event? It's when 2 out of the 6 activities of daily living are an event that you are struggling with and need help with. So those are going to be bathing, eating, continence, transferring, dressing, and toileting. So it's really the non-medical side of a care event that you don't necessarily think about, like you don't. Oops, sorry. No worries. That you wouldn't necessarily think about needing help with. But it's really important to think about these activities and know that Medicare and Medicaid aren't going to be covering any care needed for these. And then about 70% of Americans 65 plus will need long-term care insurance and be in a long-term care event. So that's just a little statistic, and with everybody living longer and enjoying more prosperous lives, that's even more of a concern to think about. And so really the main 4 things we want to think about when we're planning for long-term care event is who would be in charge of your care. Would it be family members? Would it be your spouse? Would it be any of the doctors that you have relationships who would help you with that and be in charge of coordinating that care? Another thing is where you would prefer to receive care. So I know all of y'all are still in your homes, and being in your home, I believe, is pretty important to you. And so if you want to receive care in home, in a nursing home, or a care facility, that's something also to think about as far as what the cost might be associated with those, which I'll get into a little bit later on. But and also how much does cost care for the area, because Austin is a little higher on the side, Austin San Marcos area, than other cities, since we are so big. And then what's the best solution for you? Is it going to be paying from qualified money that you have, but then you also have to think about the tax consequences associated with that. Is it going to be paying out of pocket from your savings? And will that affect your spouse or your family that might be reliant upon that? And then also, would it be partially from an insurance solution, which New York Life offers and some other companies as well. But we do have some of the most robust plans in today's long-term care market, and I'll talk a little bit about those. And if you have any questions after, I'm happy to answer them there as well. So a little bit more about who'll be in charge of your care. Most of the stuff I already mentioned, but it's important to speak with, your spouse, your children, and maybe aunts or uncles, anybody in your life that would be a part of that. It's important to have a sit down and focused conversation about the long-term care event and what you'd like for that, because one of the worst feelings is for something to happen to you and you feel like control's taken away and you don't know who's gonna be a part of that care. And then a little bit about the impact on family caregivers. I think a lot of us expect, my daughter or son or children, godchildren will take care of me. But it has a really big impact on their lives as well. Maybe they're also working. 61% of caregivers in people's family are still working. So how's that gonna affect them leaving work to help care for you? And I know that they would love to help care for you and be a part of that. But just being able to give yourself and them peace of mind and helping cover that and having a real plan is really beneficial. And then just some more of incur out-of-pocket expenses from your loved one's caregiving. About $7,000 is the average per year of the financial costs that burden them for the event. Yes, absolutely.
We're a married couple.
Yes.
Do we have to agree on each of our care?
Well, it's,
No.
you don't have to.
No.
It's what you want and what you establish. It might be nice to agree, but that's not a requirement.
Is there a point in time where you don't agree, but one of them are not agreeable?
Well, there might be, but as far as, that's why it's important to talk about it together, have each of your plans written down, shared with a loved one, and then hopefully that plan that you speak about will be respected by the other.
All I can say is, oh Lord, I do someone knocking at me.
Don't we all? Don't we all? And Sarah's
Just
trying to
a little bit is that, spouses especially, it's funny because I've been doing this a long time and the important for saying, make sure that we share. I've actually had children call me and say, my dad just passed with Alzheimer's. He was an Alzheimer's dementia vet for 8 years. He passed for cleaning out his stuff and he had a long-term care policy that he didn't tell any of us about because he forgot. Right. And so when I, at the end of, when I was selling long-term care and doing that world, it was so important for me whenever so who is that contact person? Do they know you have this policy? Can I talk to them and make sure that they know? Because often, I lost my stepmom with Alzheimer's dementia at 52, and I've gone through long-term care events with my family, and it's really, they don't really know, and then they also get a little resistant. It's hard. It's a humbling time. And so, and spouses crack me up because the way you said that, I just, because usually you ask, I sit down at the table and I have a, husband and wife, and the husband's like, my wife's gonna take care of me forever. And I'm like, so I want to see her live you right now. Like, that's one of the concerns with the spouses is that you want to take care of each other, but it's almost an injury waiting to happen in some ways. The other thing with the long-term care policies is we have a care coordinator built into the policies. It's just that you can use. That care coordinator is usually the one that breaks it to the other spouse that maybe it is time that we need to get the support equipment. We need to have transportation to rehab or PT, anything like that. The care coordinator in some ways really does help that dynamic of helping, lay out options. So that's kind of been the peacemaker in a lot of situations.
Yeah. Thanks, Sarah. And then where would you prefer to receive your care? So I talked a little bit about in your home, in your community, day facilities, and then assisted living facility or nursing home. So just thinking about those options and putting that in your plan as well. And then just jotting down when you are writing your plan out where you're going to want to have care. It might be the first year in your home or the first couple of months in your home. And then if the care needs to progress a little bit, it could move to a nursing facility or assisted living.
Can I ask you to repeat it? So it's 2 out of 6 making it,
Yes, ma'am. So
long-term care event.
yes, ma'am. So 2 out of the 6, and I'll pull those back up for you, but 2 out of the 6 activities of daily living. So that will qualify for you to start receiving your insurance plan from us, is when 2 of those things happen. And then you'll start receiving the reimbursements from the plan that.
But there's usually like a 90-day wait, right?
Yeah, so there are waiting periods.
That's outside of that.
Oh, yes, and then if it's a cognitive event, like Alzheimer's or dementia, that already qualifies you to be in a care event. And so then you wouldn't have to be waiting for 2 of these events, if you could still be moving around physically. Yes,
You yourself or your partner or.
so not us, it would be your doctor just has to verify that you need help with those.
We actually have, so New York Life is a monster company in New York, but ironically, the headquarters for long-term care is in the domain.
Here?
Yeah,
Yeah.
isn't that funny? And for me, they probably hate me being so close because I'm at their doorstep. I mean, the underwriters are there, nurses, everything we're privately owned, everything's in-house. So even if your doctor doesn't, we will send, Melissa gets the call.
Yeah.
We immediately send a nurse to you, whether it's in the hospital, at home, and they are the ones that can also verify that you're in a long-term care event and you have lost 2 of your siblings. And so it's not all dependent on what the doctors are saying, it's really, we do that internally as well.
If you're retired military, and also a VA, then that helps you out some.
It would with, if you're receiving pensions, yes, that could be helping to cover your cost of care since you'll still be receiving that. So that's something that's really important to think about is what income do you have coming in, your social security, any pensions you might have, that would still be coming in even if you were in an event. And that can help cover your costs. So when you look at what you're receiving from military or from the VA, that's definitely something that we plan into the care plan and what insurance we might need if we need it at all.
And the main thing that we ran into with VA benefits is they do have a long-term care, you're able to go get care in facilities and things like that, but it's,
Is it in Waco?
that's the question, like, where are you gonna be sent? And that is the main reason why people purchase private long-term care, because they want to be able to pick their facility, they want to be close to family. They don't want to deplete all their money and leave the spouse with no money to go on Medicaid situations. And so that's having the option is really, and we layer.
Cumberland Valley.
We layer another protection piece, a personal policy as well, often.
Oh, I never did.
And then here's an example of some of the costs associated with home care, assisted living, and nursing home costs. And this was from 2023, so fairly recent of the Austin and San Marcos area. And that's what you can expect per month and per year. So really how much you want to plan to cover of your care, we can talk about individually, but these numbers are a good thing to base that off of when you're thinking about how much you need to save. Yes, ma'am.
When do you bring in your financial advisor into this?
I would bring them in pretty immediately to help you review what you already have, what assets are already in your plan, and I can help coordinate with them as well, if you have any more questions about it. So I think it's something that you definitely should speak with them about, and see where your assets are, and if you could pull from those if a care event were to happen, or if you could reposition some of it, because one of our options, actually, you can reposition some of your qualified funds to go toward that. So you might have funds in your retirement that already exist that could help cover a cost of an insurance plan.
What kind of person is that when you call?
Call what?
Financial advisor?
Your financial advisor or your CPA, whoever is familiar with your finances, or even yourself. Sure.
Yeah, and I mean, we require New York Life that our advice, like Melissa has.
Can't hear you.
I'm sorry, you're right. Her Series 6, SIU 7, I mean, she's
I'm a registered
a
representative.
registered rep
as well,
to be able
so.
to look and balance. Because the main thing that we're looking at is hedging retirement account.
Yeah.
Right, we do not want, if you have 100,000 earmarked for a long-term care event, that may not cover, probably won't cover the average cost. So what we look at is earmarking, moving funds over and balancing it out so that this money is sitting here, it's going to pay you 100,000, will pay you out 400,000 for long-term care. But you have it, right? If not, it goes tax-free, and then we also make sure you have enough to live off it. So the full you know, portfolio analysis is what we do whenever we place long-term care.
Right. You know,
Make
the
sure
main,
that-
yeah,
Deductible for income tax?
Great question. Yes, there's a lot, it depends on the type, and she's going to go into that, so there's some major tax benefits.
yes. And so just again on cost, these are the average of a 3-care long-term care event. For some of the big cities in the United States, Austin falls between these two on the end a little bit, somewhere around $230, $230,000 for a 3-year care event. Yes, ma'am?
What happens if you exhaust all your money?
So if all your private money or all your insurance benefit money, all your savings, either or. So that's why this is so important to talk about ahead of time and be prepared for, so that an event like that weren't to happen.
Yeah, and what they've done is they have, they're bouncing off each other.
Yeah.
But policy, let's say a long-term care policy, a qualified policy gave you a $200,000 pool of money for long-term care. Let's say what they give us this tax benefit that she'll go into where it's written off as a medical expense. It's the only insurance premium is a medical expense, so it goes towards your out of pocket. But let's say one spouse depletes their entire policy, has to go into a long-term Medicaid facility, okay? Medicaid, they require you to deplete your assets. You need to get down to a certain minimum levels, and it's really hard for the other spouse to survive, because what money are they gonna have? What long-term care policies do, they're qualified, is that they actually, if you have a 200,000, they allow you to keep 200,000 in your bank account and still put your spouse on Medicaid. So they're protecting.
It's a little lower, Sarah, 100.
Protecting
Melissa?
assets, yeah.
Can you
Oh,
come
yeah, so
sit
we
up,
come in front of the
up
camera
here
back
just
there,
so
yeah.
people online can also
Can hear
hear?
as well.
Thank you. Sorry.
No problem.
In the average length of time in long-term care, though, just 2 to 3 years.
So for a non-cognitive, yes, it varies based on men and women. So the average care for a man is gonna be about 2.2 years. So really you want to plan for 3, and then for women, it's gonna be about 3.7, plan on 4 for a non-cognitive event. When it comes to cognitive, the average is about 7 years. So a bit more that you might want to think about and build into your specific plan that you write out. Yes, ma'am.
I've been researching not assisted care, but independent living, which is the lower level. And consistently, I have been told that I should expect a 7 to 15% price increase every year.
Every year. So that's another thing is inflation to think about. These costs today are going to continue to go up, especially with the amount of people living longer and the more people needing to go into care, and also thinking about the lack of skilled professionals that are going into those professions such as nursing, doctors. So that all plays into the increase of cost of care every year. Yes, sir.
Slide before,
Yes.
you had the 3-year cost.
Yes, sir.
Does that, what, can we go back to that?
Yeah, let me go back to that for you. This one?
Yes. So what does that mean
So,
at-home care, institutional care? What?
yes, sir. So it's gonna be 1 year of at-home care. And then the second year of your event, maybe things progress, being at home doesn't make sense anymore. Then it would be 1 year in a 1-bedroom and assisted living facility. And then third year, if you need more in-depth full-time care, it's gonna be 1 year in a semi-private room in a skilled nursing facility. So it's upping your care each
Right,
year
right.
and planning for that.
Find semi-private.
Semi-private, so the room you'd be sharing with somebody else. So a private room would be a bit more than that as well, so, and it could be your spouse, but yes, ma'am,
We're 83 years old.
yes,
We
ma'am,
don't have to.
yes.
It's expensive to get a plan at 83.
So you actually wouldn't be able to get a long-term care plan at age 83 with us, but I'd be happy to still meet with you and look at what assets you already have in place to just think about and help look at them and see where you could pull from if a care event were to happen.
I would think it would include the financial advice. too.
Yes, ma'am, absolutely. Absolutely.
Thank you.
Yes, absolutely.
Yeah, and one thing that we do on that is there's certain annuities that you're able to place money into. And it pulls, it could pay out tax-free for the medical expenses. So if it's a qualified money, right, we wanted to pay out tax-free if possible. And so we're able to pull, instead of just cashing out retirements or having to sell a home, we put that earmarked amount of money into a vehicle that will then at that point still pay out tax-free to medical expenses. So we do a strategy, if you can't get approved, it's past, 79 is the age that we go to, all companies go to. But that at that point, it's shifting it into like a pension for yourself, or that will be activated when you go into care. And it's very easily done. We do it all the time, purely just for the foundation of long-term care getting paid for.
And as your husband mentioned with the pensions, that's something you're gonna take a look at as well, to see how much would be coming in from those. And if it would still cover both of your needs, if one were to event, or if we need to look at other routes of funding.
Yeah.
Can you define the word event?
Yeah, so it's official long-term care event is when you are triggered either a cognitive event, which you don't have to meet 2 of the 6 activities of daily living. But then if to qualify, you would have to meet 2 out of these 6, which are bathing, continence, dressing, eating, transferring, or toileting. So
Yeah.
that's the defined long-term care event, which would trigger the insurance policy. Yes, ma'am.
That's the definition of event.
Yes, ma'am, that's correct. Sorry, I'm using that word.
Usually triggers you to go into your facility, leaving your home.
I would say if you can't cover your property tax anymore, if the mobility at your home no longer makes sense for the amount of care you need, say you needed help with bathing and eating, and then it really depends person specific, and what you want to do, what your decision would be. It's not necessarily you have to go into this facility, you have to go out of your home. It's if it still makes sense financially and physically to still be in your home or not.
And it's a fall. Often I see it just a fall, right? A fall will trigger an event very quickly. And we have 0-day waiting period in home on our policies, which is nice because you can get someone in there. You don't have to do the 90-day.
Our home is 1 story, no stairs.
Oh,
Right.
good.
Okay,
Mhm.
and ADA all over.
Yeah, that's wonderful. That's what we did for my mom and grandmother as well. As when we built the house, we just made it extra wide door frames. But your policy would actually pay, it has an allotment above that pays for putting up a bar near a toilet or a shower, widening door frames, building a ramp, all those things just add to it.
So y'all are ahead of the game with having your home already fitted out for it.
I think we could bring our home out of this.
As a facility?
Oh, yeah.
You could,
Yeah,
yeah.
totally.
You could. Thank you. Who's gonna manage the rental?
Coming in the minute.
Let's have a son that's gonna take over everything.
Absolutely,
We go out to lunch. He's got everything.
absolutely. So, yeah, if you've talked about your plan with him, then that's amazing and y'all are ahead of the game, really.
And he'll be your care provider?
Will be your care
Your care
provider.
provider?
He, I mean, he would take over. I think so.
He would find your care provider.
But he's in the will, right?
I think he'd take over the cigar box with money, you know.
Yeah, and that's the thing with my mom coming down. I'm
Be a
excited
foil.
to have her. I want her living with me. I'm turning 50 this year. It's kind of nice to have mom back. But at the same time, I will do certain things, but I won't do other things. And she wouldn't want me to do other things. Like there's with bathing or, those are certain things. We kind of have been able to talk about what are we comfortable with, what aren't we comfortable with. And it's just opens conversations. for
How
that.
many people have in-home care?
About 90%.
The question was, how many people have in-home care?
Enough people out there to take on a job like that?
Right now? Yes. The in-home care policies though, we coordinate that. So that's part of the advantage of being with a company that keeps everything in-house, is we help find the care provider to come in, help with any receipts, things like that. But also the policies, let's say that you do have that child and they do want to take care of you, but they have to leave their job to do it or leave their kids. They have to possibly, the policies, you're allowed to pay that benefit that you'd be paying to a nurse to come in. You can actually pay as well your children.
Is it a
Friends.
24/7 person or do they have different various waves of people that come in.
It starts slow, usually, it starts with maybe just a couple days needing someone to come in. And then eventually you can, you'll be progressing to, if you need around the clock care, then, your policy, the amount that's in your policy can cover it. And this is something that parents are talking about, but then also looking at what do they want to do for their children? Because that's the 40-year-olds, 30-year-olds, those are the ones that are gonna have skyrocketed medical expenses. So
Is your
it's-
premium subject to how old you are?
It is. So the two things that will affect your premium, or well, three really, is your age, your health, and then male or female is something that is kind of fit into your cost, because we do expect that women will be in a care event longer than men will be.
Women are living too long.
Thankfully.
Just living too
Doctors, they
long.
want to.
How much of a difference? I'll show you actually. So I've got an example of a 70-year-old on one. So we've got two different types of long-term care policies. We have traditional long-term care policies, which are just traditional long-term care. So it's going to be 2 out of the 6 events. There's no death benefit. There are options for return of premiums in some of our plans. Others there's not. And then we also have a non-traditional, and so the non-traditional plan is a combination of long-term care and life insurance. So it would cover your cost of care if needed and you go into an event, or leave a death benefit for your loved ones. And so for a 70-year-old, the main difference is going to be $145.21 a month for a 70-year-old male. And then the price difference that's for $100,000 of care covered. And then for a female, it's going to be $223.15. So it's a pretty big difference when it comes to cost.
Do you have a slide that goes 70 through 79?
I do not,
Okay.
but I can send that out to you guys.
I could
Maybe
make it real. I was just
I
thinking
wish.
about those devices.
I wish, 83. Yes, sir.
What is the age limit to be able to get this type of insurance?
It's 79. Yes, sir.
So what does a 90-year-old do?
A 90-year-old, hopefully that,
That quick.
We're putting, we're making sure.
Not soon.
yeah, make
That's
sure.
my plan.
There's this feather pillow approach.
Yeah, he asked what happens to a 90-year-old, and I would say, again, it's thinking about this
Plans, I
now.
was like 60, it didn't
So
work out.
Nathan, since we didn't jump in earlier, we missed the boat.
Yeah.
Not necessarily, because you might have qualified money that can be taken out, and there would be tax consequences of that. But you might have other assets that maybe whoever's managing your money or yourself that you can look at now and say, okay, let's try to reposition this into, like Sarah was saying, an annuity, which isn't medically underwritten. So that could be something you could look at as well. So there's some options there as well. Like, I'd be happy to still meet with anybody over 79 to help you guys look through what you got.
You don't know what you just said.
I can meet with everybody.
Well, every Sunday I look at the paper. Take a tally. 1, I'm not in it. Number 2,
Exactly.
I look who did it, see if I know anyone. Number 3, I look.
It
What
went
age
through
did people
102.
die? They die, like,
Right.
and I, as far as I'm concerned, I'm way ahead.
That's amazing. Perfect.
I want to give a little better description of what that annuity does.
Okay, yeah, so one of the, well, we offer a lot. I don't have that.
I'll get it on here. Yeah.
But, so the annuity, we offer a few different ones, but it would basically pay you an income. And you can do it that it's a deferred annuity for a certain age, and you can change that age once annually, every year. And so then you can set it up that way and just plan for, you can look at your family history, anyone in your family, if they've gone into a long-term care event, and set that age for that time. And planning it further out is the best thing to do. And then if you need to move it up for a care event to happen, you can do that. But it would basically pay you, and you can pick which way, but either a monthly income or an annual income. And you could receive money from that when you were to go into a care event to help cover costs.
Yeah, and it's just diversifying the taxes a little bit on that. So you basically earmark funds right now, we move it over. We want, the worst thing to have to do is all of a sudden pull out an extra 70,000 out of qualified funds and have that whole tax consequence, send you up a tax bracket. So what we do is we move money down, saying, okay, when this long-term care event goes into long-term care, we're gonna have it, positioned so it'll pay 4,000 or 5,000 a month for the rest of their life to make sure that those long-term care costs are gonna be covered.
What kind of percentages are you talking about of income? I mean, of investment income?
Well, it depends on what your total assets are.
Well, say stick with your 70,000 or
Yeah.
100,000.
So you're allowed to put a certain amount of, well, you can't at 70, I just have a 76-year-old. We were only allowed to put 60% of her total assets into an annuity, a deferred annuity that would, for qualified assets, we're going like this, you know, they're kind of up and down all around. What we want to start doing is shifting. So as we shift into a safer asset here, what it's going to do is it's going to guarantee like a 4 to 5% return, something that's like a CD on steroids. But the key is that any earnings that you get in there, you're not paying taxes on the way out. So we're minimizing it. It'll slow drip and diversify those taxes. It's just a plan for making sure that the money's there when you need it. Okay, and then also going to be left efficiently to, my favorite is the spouses. They have this annuity. If one passes, the other one still gets that payment the rest of their life. It doesn't die with just one.
This is individual policy, but we're a couple, there are two of us. Does it break down in half or?
So for long-term care policies, it is two individual policies, but you have the ability to, if you're approved, now getting approved for long-term care is a little different than life insurance, but if you can get approved, what happens is, and both of you get approved, you're able to share each other's pool of money. So if one doesn't use it, the other one can. Yep, and then also, let's say that we lose one of the spouses, they still keep that shared rider on there so they can still have access to the whole thing. It is able to, the policies are individual though, right? But there's also some that leave a death benefit. So it's like, we're gonna put this money in, we're gonna reposition this amount of money in here. And if for some reason we don't use it, we're gonna just leave 1.5 times that with tax-free death benefit. It's about not leaving a huge time consequence to your heirs.
And what Sarah was saying about being qualified and underwriting, the percentages go down as you get older. So about 56% approval rate for people age 70 to 79. So it's important to talk to with your children as well. It's something that maybe they want to start planning for an event like this. If you might feel it's too late, but it's not too late to share it with your children and have them create a care plan for themselves. Underwritten, so it's basically underwriters will look at your health, your age, your gender, all of any conditions you have or your family history, and then determine, and I don't see that it's protected by HIPAA, but you approve it to be shown to our underwriting team.
So it's almost like an appraisal.
It's like an appraisal of your health. So a little bit more about the underwriting process. It's going to be your physician seen in the last 5 years, current past medical conditions, and then any current medications and dosages. And then we covered this a little bit already. And so just thinking about all of these things, who's going to take care of you? Where do you want to be cared for? Where are those funds going to come from? And what plan are you going to write down and share with your spouse, your loved ones, anybody that would help be in charge of helping you get into that event? And so pretty much exactly.
Is it necessary to leave those instructions in a will?
Well, you'd already be passed at that point, so you'd be dead at that point.
You'll have a power of attorney.
Yeah, your power of attorney, that's something that you want to make sure that they have.
It won't be your concern, will it?
No,
it will be, all the way.
And kind of what I mentioned already, and some of you that are over 79, insurance may not be a part of your strategy, but all these other funding options that we've spoken about could be. And so you also want to think about revisiting it every year. Like she mentioned, there's price increases that are happening, cost of care every year. So re-looking at that every year, sitting down and seeing, okay, are we still okay if we were to go into a care event? And you had a question?
Both of us have insurance in place.
Absolutely.
That
So insurance,
Do we need more insurance?
What insurance?
what is, yeah, what
Depends what you
insurance?
have.
Yeah,
It's with New York Times.
so it's a whole life policy? Is it a whole life policy? We could pull it and see if it has a chronic care rider on there, which I'm hoping it does. Because that can also allow you to accelerate, we can pull both policies and just do an audit.
Yeah, and I'll get with you and give you my contact info and take yours, and I'll be able to look over that for you.
Yeah.
Okay, I think we need to sit down.
Yeah, absolutely.
And then the one thing that, real quick plug on the tax benefits, if you have an LLC, S corp, anything, any business of your own, you're also able to write off long-term care premiums through the business. So they want you to be able to write off your premiums individually, yeah, as a business, then individually you can write off your premiums, like you said.
Up to a certain max.
And then the other thing is if you have an HSA or FSA account through work, you can reimburse your premiums, through HSA and FSA accounts.
Well, because none of us work anymore.
Right, right. Some of them
but, I
had
mean-
one that like an I guess it's an HRA now, they rolled over maybe to an HRA account.
We have had a long-term health insurance policy for probably 15 years.
Oh, good.
Great.
We've been paying for it for 15
And
years.
who is it?
We do wonder, will we be able to
No, you won't.
cash in?
Well, you know, we look at those a lot. There was full general policies that were good. A lot of the companies that wrote long-term care had to sell out because they weren't priced appropriately or they're raising rates a lot. Once you start getting letters saying, okay, your premium's supposed to be a level premium's going up double. If
Not
you
like
start
double.
seeing that, let us take a look.
Let's take a look at it.
Yeah, we know I was appointed with 6 different companies, but New York Life is just the only one through AARP and AICPA's that I wrote through. Yeah, so we can let you know what you have and give you advice.
I would like to suggest that before you do anything, go visit a couple of nursing homes and see what it looks like.
Been there.
I've been there.
Then there
Yes.
was.
We do a lot of that.
Do a lot of
We've
that.
been to a lot.
Because you might want to think
We
about
don't want to be there.
why this care can be good for you to stay home.
Feather pillow, be staring at walls.
Yeah.
Or maybe the trees in the backyard, the birds that are coming by. But that's pretty much all we've got, for you guys. And there's some additional resources, which I can have them send out. Do y'all have a newsletter or something?
Yeah, we usually send a follow-up email after
Okay, great. So I
events like
can-
this, especially if there's a lot of information. So
Absolutely.
if you can send me the PowerPoint, I can get it out. to
Absolutely.
everyone.
That way,
Brochures in the back that have all
Oh,
this
great.
information.
yes,
too, with the
that's
tax
printed
benefits.
and everything. But some additional other resources would just be our cost of care tool. So maybe your family's not in Austin, you don't want to go into a care event here. You can look at where they're living if you want to go to a care event where they're at. The AARP website, New York Life is the sole long-term care insurance provider for AARP. We're the only ones that they endorse. And so their website has some information about us as well. And then the Health and Public Services website to be in your home. So the Administration for Community Living has a lot of LTC information there. And then, of course, our website and meeting with me personally and Sarah, we can help dive in a little more to your specific
It
situation.
seems like if you did get down to a point that you couldn't travel,
Absolutely.
you got Uber.
Yeah.
That's number one. Number two, if you can't cook, you got
You need help with that,
all the people that bring stuff to your house.
right?
And your policy would reimburse you for Uber.
Mhm.
Your policy would reimburse you for having someone have to come in and cook and clean
You-
or.
Travel and cook.
And you got your
That's good.
home,
Yeah,
Yeah,
and
absolutely.
listen to TV and everything.
absolutely.
And if there's even a shot or something that you need done, it has a built-in amount to train. Maybe someone in your life that wants to do that for you. I know that when my mother went in and she was so resistant to the nurses and to new people, she wanted familiar faces around.
We got people that beg to be our future.
Yeah, right.
I mean,
Well, then you can pay them to do that. Yeah.
and we know, that's what I'm saying.
Yeah, and it's really, I think that it's just about having all the scenarios, but then also making sure that you're just taking, I know with children, taking care of their parents, and it's a lot of receipts, it's a lot of time, you know, it's a
Extension
full-time job,
there.
sometimes just being the administrator of that long-term care event, and that's why we build the coordinator and as well to help with that.
Any
Really
more-
thought out, yeah.
All right, well, I got the word from the boss that presentation.
Yes.
We're gonna have to come, bring it to a.
Yes.
To a conclusion. Yes, sir.
As far as prescription coverage, we have Express Script. That was the best ones around.
And for those of you on Zoom, they'll have all my contact information and the presentation sent out to you guys through your follow-up and newsletter.
Sorry, that's the.
Oh, no worries.
Not everywhere.
You sure I can do that? Okay, see, this is the way I cover the camera right now.
And I guess you could get one of that.
I didn't know.
Oh, yeah.
That's not
Yes.
great.
Yeah.
Well,